While I got you on here, I want to just change topics just briefly because there's so many of our subscribers who are very worried right now that they haven't been able to afford a health care plan on the Affordable Care Act exchanges. Now they don't have health care and they don't know what to do, or maybe they have a family member who's now been kicked off of their ACA plan because without the subsidies, they can't afford it. And I know we've gotten so many comments. What can we do? What can we do? So what's your guidance to people right now who have been thrown off their health care plans because of Trump and the Republicans refusing to have this vote to extend the ACA subsidies?
No, Ben, thank you for that tee up. A critical topic. And as you pointed out, we've gotten a lot of outreach from Midas Touch, Midas Health listeners and viewers on, can we do something here to just put good information out? As everybody knows, January 1st, first day where the lack of subsidies to make healthcare affordable for those 24 million Americans who get their health insurance on the Affordable Care Act exchanges throughout the country. January 1st, yesterday, was that first day where these prices are taking effect. These are having real world impacts on people and families. So what can you do? If your health insurance premium now is unaffordable, in many cases, we think for at least 5 million people, they're going to go uninsured, many more underinsured with the type of plan that's going to be high deductible, will basically just cover catastrophic healthcare expenses, but difficult to really afford anything else. What should you do? I should say none of these pieces of advice substitute for federal action on just extending the subsidy. So I hope that happens. And I hope this guidance ultimately proves unnecessary. But what can you do? One, go to healthcare.gov. If you're in this situation with unaffordable healthcare premiums, you can still go to healthcare.gov. It might seem counterintuitive, but there's a special enrollment period where you can look and compare for so-called bronze level plans. These are plans that tend to be high deductible, are less generous in terms of what you can get, but the premiums tend to be lower. In some cases, the premiums for the bronze level plans will still exceed what somebody's saying a silver level plan got in 2025, but it's something to at least look out for. And you have 60 days after saying, say you didn't really enroll in coverage, you have 60 days in the special enrollment period. So through March 1st to switch to say a bronze level plan. So that's something to consider. One, you might be newly eligible for Medicaid, Ben. And so whenever there's a premium redetermination, if premiums increase, people might now be newly eligible for Medicaid. And I should emphasize, Medicaid has a year-long enrollment period. It's not open enrollment just for, say, 6 weeks towards the end of the year, which is typical of most health insurance plans. Medicaid, you can enroll at any point in the year. So something to keep in mind, maybe you can actually qualify for Medicaid. A question to ask your physician, your clinic's social worker, if you don't know where to go, do you now qualify for Medicaid? Number 3, federally qualified health centers across the country, FQHCs for short. And these are places, bedrocks of care in communities across the country that essentially provide care to those on Medicaid, those that are underinsured, those that have no insurance. And usually the price of that care is tied to their ability to pay. The price of that care is tied to their ability to pay. So if you haven't ever looked at an FQHC and you're in this position where their health insurance has become unaffordable, perhaps now is the time to look to your federally qualified healthcare center in your community. And there's usually one not far from where everybody that's listening to us is living. Go and consider that. And usually they tailor their fees to ability to pay. So something to look at. And lastly, medications. I get a lot of questions, Ben, from folks wondering, well, gosh, doc, I'm worried about my meds. What should I do about my meds? One thing you can do is ask to switch from a 30-day refill on your meds, your chronic meds, your inhalers, your blood pressure medications, your diabetes medications, to a 90-day. That tends to actually save money, going from 30 to 90. So you can do that. There's a lot of generic alternatives for branded inhalers. I'm a pulmonologist. Ask for a generic alternative. Ask your prescriber, your medical provider, can they prescribe a generic that might do the same medical benefit as a branded medication? And then usually, I look at cost plus drugs. I look at entities like Amazon Pharmacy. These entities, Walmart, now have cash pay options that don't utilize insurance spend for chronic medications that tend to actually be lower for medications than somebody's copay. So now actually circumnavigating around your insurance and just paying cash for your blood pressure medications, your diabetes medications, your asthma inhaler, frankly, in many cases through Mark Cuban's Cost Plus, Amazon Pharmacy, Walmart, other entities like this can save you money than applying your insurance. So something to consider.
I think all very important practical advice. I mean, it's shameful that we're here where that advice has to be, given, but it's stuff that people can really take with them into the new year and implement in their day-to-day life. Dr. Vin Gupta, thanks for sharing all your knowledge. Thanks for leading Midas Health. We appreciate you.
Thank you.